welcome to my channel. In this video I'm going to talk about boils. Of course, boils have been common nowadays because of unhygienic maintenance of the diet and cleanliness and everything, because of the air population, water population and everything. So first we'll be understanding what is boils and what you can do if you are suffering with the boils. Painful boils, pus-filled bump under the skin caused by infected air follicle. This is boil. Okay, it only happens in an area whereas face, neck, armpits, thighs and buttocks. Most probably for buttocks and the thighs is common. Armpits is also common because it's a sweating area and some people does not clean it well. But as face and neck, it's not common, but it appears on the face and the neck also. So what you can do if you're suffering with the boils? Some or most boils resolve on their own with a proper home care. So they does not need any kind of treatment and everything. And some need an medicinal treatment because the infection is been more. If you're having only one boil on your skin and it has gone away after 1 week, then there is no need of treatment. What you can do at home? One thing you can do is warm compression. Means take a towel which is of warmth, just press it on the boil, keep it for 10 to 15 minutes and put a pressure on that. After that you just take it out. While you do this, the infection level comes down and the pus which is collected inside comes out automatically. Keep the area clean. Okay, this is one of the specific thing. Clean your area, and you can also apply some Dettol or some kind of mother tincture or some kind of hot water cleaning, anything you can do. Pain relief. For pain relief, you can really kind of put an hot compression, and what you should be avoiding is that picking up that boils and pressing it out, squeezing it out and wearing a tight clothes and leading it to that frictions and not covering after removing the pus, not covering that area and everything. To cover that area you can use the pimple patch. Okay, when to see a doctor or take a medicine when you have an boil? When to see a doctor is boil gets larger till 2 weeks. Means you had already had a boil and it's been getting larger and larger every day and it's not at all going out even after the home care, then you should be visiting a doctor, because it is also very dangerous if you leave it like that, because it's been increasing. Means the bacteria is been increasing, the pus formation is been increasing. And if the boil is on the face or on the spine, you should just go and consult a doctor, because if it is related to any other correlated diseases, you should first rule out. Next one is fever, swollen lymph nodes or redness. Any kind of thing may happen to you. That time you should go and consult a doctor. For most of the people I had seen who had got an boil, they will be having a slightest fever. If you're having a slightest fever, no, there is no need to worry, because whenever there is an infection, of course there is some kind of fever in the rise of temperature in the body, but it is more and you cannot tolerate it, and there are so much of things which is going around, and there is so much of redness, burning, painfulness which you cannot tolerate. Then you can just go and consult a doctor, where they will be also giving a medication for to reduce the inflammation. When the inflammation comes down in your body automatically gets cured. Multiple boils together, means one boil has come after 1 week, other 2-3 comes together with that, and the area is becoming so much larger, or the boils is kind of one is on this side, one is on that side, like that, more than 2 to 3 boils on the same person, then you should go and consult a doctor. Why this boil happens? Because there is so much of pitta in the body. So you should control the food which you are taking, means the heat content in your body is being increased. So you should reduce that. If you reduce that, the infection level also kind of comes down. Okay, now I'll be talking about what are the homeopathic factors which are really helpful in the treatment of boils. First one and foremost, a top remedy for the boil is Arnica montana. I hope you had already heard the name Arnica montana for the air fall, air regrowth, split ends, or any kind of injury like that. Of course, even the boil also is being covered with the Arnica because it is related to the skin and the hair, because the inflammation or the pus formation in the hair follicle is called as boil, right? Because of that. Okay, what you can do with Arnica montana? Arnica montana is mother tincture is available in the pharmacies, where you can take Arnica montana mother tincture and you can just take a piece of cotton and you can just put 2 to 3 drops of Arnica montana and just kind of put it on the area of the boil and just kind of put some bandage or any kind of stick it out. Okay, don't remove it. After 2 to 3 hours you can just remove it, or if the boil has been opened up and the pus is coming out, you can just remove it. After removing, what you should do is take little bit of warm water, take one clean cotton, just kind of clean that area, remove all the pus. Don't intervene your finger because it's going to leave the marks. Just press it little bit of pressure, the pus comes out, clean it out with a warm water. After that, just take another piece of cotton and just put Arnica montana 2 to 3 drops and just put it on the area of the boil. Of course, it's going to little bit give you stingy kind of thing because the alcohol is there, but it's going to be all right. After that, just cover that area, don't leave that area open. Okay, if you do it for 3 to 4 days as an first aid, of course it's going to be get cured. Some boils does not open up because they will be very small or they are kind of weak like that. It's okay, but it should go away completely. Till that time you should follow the same routine. Okay, if the boil is not coming out, that does not mean that it is not growing inside. Some things will be growing inside. Till your skin gets normalized, you should be doing the same routine. If you want to take Arnica montana pills in the pills form, you can take, but external application is must and needed. If you ask there is any kind of cream, don't go for any kind of cream. Arnica montana mother tincture is the best. Okay, then if you ask, okay doctor, I'm doing external also, I want it internal also, then you can take Arnica montana 1 one dose, it's enough. There is no need of repetition, there is no need of taking medicine daily, nothing. 1 dose, one time, that's all. But mother tincture you should be applying in the morning and in the night, both times. You should clean that area, apply it again. Okay, Arnica montana is mainly for the small boils with painful one boil cured when the other comes out. This is one of the common thing which happens in Arnica montana is after treating one, after 1 week another one comes out. If that is been repeating out, then the internal medication is needed. For that you should consult an doctor, nearby homeopathic doctor. Anyone can help you out. Just go and consult them and they will be able to help you out. If you have any kind of queries about boil or any other kind of diseases which you want to know about homeopathic treatment, just comment on the comment section so that I will be able to help you out, guys. Please to like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video, you will be notified. Myself, Dr. Megha from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. Thank you so much. Have a nice day and a great life. Thank you.